5 major changes to insurance laws now up for discussion at the State House.
The legislation lawmakers are considering could impact everything from hospital bills to insurance costs. Atlanta News First investigator Anastasia Olmos has been looking into this and how it impacts you. She's joining us live at 5 from the Capitol, where a House subcommittee held a hearing on this bill today. Anastasia.
That's right. This bill actually passed the Senate 2 weeks ago, and it did have one section amended. Now, even today, there is still pushback about some of the wording in that section, those changes. And the wording's so important because it really will affect every Georgia resident, especially those, one doctor says, that are underinsured, those that can't afford the medical costs of care that they need. It was a rainy night in 2015.
Whole life changes in an instant.
Betty Washam was driving to pick up her daughter.
I was T-boned in a terrible car accident.
Paramedics rushed her to the hospital with injuries that would take years to even diagnose.
Nerve damage in my back, herniated disc in my neck. I had torn meniscus in my knee. I had torn labrum in my hip.
Betty had just switched jobs from a cashier at Publix to Kroger, paying for Ambetter affordable marketplace insurance while waiting to qualify for her employer's health coverage. But she says she couldn't find a single specialist that would take her insurance.
I don't see how some patients can make it.
She hired an attorney who helped her find an orthopedist and a third-party funding company to front the medical costs while they went to court with the insurance company of the driver who hit her.
It ended up being 9.5 years.
And so many surgeries, she lost count.
I don't even want to think about it. It was so many.
She got surgery in her hip. She got procedures in her back. She had something called a spinal cord stimulator.
Dr. Shevin Polydor performed many of those surgeries. He says the law that allowed the third-party funding for her care is threatened by a few words in Senate Bill 68 requiring approved insurance costs to be disclosed in court, regardless if insurance was even used.
What people don't understand, there are lots of treatment that Medicare does not cover in certain settings, like fusions in our outpatient surgery centers, and all of that, you won't even be able to present those bills.
Dr. Polydor worries about people who can't afford insurance deductibles or copays and rely on third-party funding companies in order to get care.
Our estimate is that at least 150,000 people a year in the greater Atlanta area will lose access to health care because of this.
While there's been some compromise on this part of the bill, it's words surrounding dollar amounts and disclosure that doctors, insurers, attorneys, and politicians are arguing over at the state capitol.
I think it's important that we haven't heard from the insurance companies because they're not the ones here asking for help.
Y'all have to have some more work done on my neck.
Dr. Polydor hopes lawmakers keep people like Betty in mind.
If her case settled after SB 68 and she didn't have the money, they could go after her house. And for future patients, they may not even offer that care.
I just know the kindness that I received. I'm thankful for everything that I have.
Now, I asked the governor's office about these claims that patients could be left without care. A spokesperson told me in part that the way that these current laws are right now, he says people that are benefiting from them, they are spreading, quote, falsehoods. Now, the subcommittee here at the Rules Committee here in the House, they plan to have another hearing next week. Reporting live from the Capitol, I'm Anastasia Olmos. Atlanta News First investigates.